Okay, you are live. We are live now. Hello, everyone. So my name is Ben, and today we have another beautiful lady. Okay, last week we have two. This week also we managed to get two. So difficult to get them. Okay, so we have Simran. Okay, although the name is
Hello,
long, but we can call her Simran. And we have Shuki. Yeah, and we have Shuki from our physician from 1TCM. All right, and Shuki, I just get to know that you are now in Bangsa Village 2, right?
Correct.
Yeah, you're now. Yep. Okay. So all our audience, dear audience, okay, comment +1. Okay, comment +1 if you are watching us. Okay, let us know that you are watching us. Okay, so today our topic again, we are still linger around women's health. We are still talking about women's health, and we are talking about low back pain today. We are talking about low back pain today. So and today we have two speakers from two professional body. Okay, one is BENPHYSIO, Simran from BENPHYSIO, and we have Suki from 1TCM. All right, so shall we start the show?
Yes,
so
we should.
All comments, yep, +1 if you are watching. All right, thank you, Gamesh. Okay, so yes, so we are still in the topic, big topic, huge topic of women's health. We are still talking about women's health. And of course, if you are not women, can you join our live today? Of course you can, because you still have your low back, all right? Yeah, your spine is still there. You still have a low back. Yes, you can join us. All right, and today we're going to talk about low back pain, okay, by these two professional physician and physio. All right, so we have two different Western and Eastern knowledge to help everyone, okay, to look at low back pain. Okay, so Simran,
Yes.
I'll pass the mic to you. Yep.
Yes. Okay. So guys, now today we're going to talk about low back pain, yes, but first we're going to talk about arched lower back. That is one of the main cause of lower back pain and how it all starts. So if you notice that you have an arched lower back, okay, yes, you are likely to have lower back pain in future, or you must be already having it now. That's why you're watching us. All right. So how we're going to go about this is, if you have weak core muscles, okay, what happened that your weight, your pressure is all distributed, all going to the lower back, and therefore your lower back become very stiff and tight. Okay, lower back becoming very tight is the cause of low back pain. That's what we think. Okay, but then the main reason is also coming because of the weak core muscles. Okay, when all of this happens, what happens next is that you'll have a very weak buttock, and also all the thigh muscles in the front of your thighs, all of this will become very tight. So this pattern is called lower cross syndrome. Okay, you can Google it as well. So this is the main idea on how this low back muscles will become tight in the very first place. All right. So moving on next.
So okay, before this, okay, so in summary, what Simran was saying is, so that means Simran, when we come for attend physio for our low back pain, so you will not work at our low back only, isn't it? Okay.
Yeah, we wouldn't touch low back
only. Yes. Okay. So you also look into the stiff muscle, which is from the front, as well as our weak muscles, the core weak muscles, as well as the glutes muscles. Correct?
Yep.
Yes. All right. So this is our unique point, okay, of physio. Yep. Okay. So how about TCM, Suki?
Yes,
So
hi,
what is
everyone.
the TCM point of view about low back pain?
Okay, so basically how TCM view it is that lower back, the lumbar region, actually it serves as the residence of our kidney system, right? Because 腰为肾之府 is where the locations of kidneys are. So anything related with the lower back region, maybe the first system that we can encounter is either kidney. Yeah, this is the location of it. All right. So actually, low back pain affects up to 3/4 of all pregnant women, usually in their third trimester, maybe from 6 to 9 months of pregnancy. So basically, if you have this low back pain, history of low back pain before pregnancy, and for those who involve in the physically strenuous exercise or strenuous occupations, they actually are at a higher risk of developing such conditions. And the onset of their back pain can actually occur earlier in their pregnancy stages. Okay, and of course, pregnancy, weight gain, all this actually related and actually will cause more stress on the back. Shall we move on?
So, okay. Thank you, Suki. So in a summary, if low back pain patients come and see a TCM, the first priority things that we look into is the kidney area, kidney function, and kidney system. Correct, right?
Correct.
Yep. Okay.
That's
Thanks,
right.
Suki.
You're welcome.
Yeah.
Yep.
Okay.
All right. So we're back to Simran again. So is there any classification for low back pain according to your experience?
Yes, there are classifications. The first thing that not the first thing, but these are the few things that we look into. Most common one is multifidus cramp. We call it in short multi-cramp, and also sacrum swelling. So these are the two diagnoses that we often see around here. Okay, so now we're going to talk about it in depth. So we go to the next slide. So remember these two names, yeah, is very important. Okay, next slide. All right, so now we're going to talk about the location of this muscle called the multifidus, in short, multi-muscle. So this muscle, we have three parts. They have in the neck, in the mid-back, and also in the lower back. Okay, so for lower back pain, focus a lot on the lower back of this multifidus muscle. The origin is coming from the butterfly bone, our hip bone here at the bottom, and then it goes up and attached to 2 to 3 vertebrae, that means the backbone, starting from the origin. So it's not like one long muscle, it's pieces of small muscles attaching above one and above of each other and all the way up. So this is where the muscle is. So when you come to us, after treating the cause of your lower back problem, we will also work on this multifidus muscle, which is very close to the spine.
That's why those always have low back pain, they always complain that they have the spine pain, the bone pain.
Yeah, correct.
So actually the bone does not pain, but it's the muscles near the bone is painful.
Yes.
All right? Correct. Okay, so I'm correct, right? Good.
Yeah, very true.
Okay, so, So what are the symptoms of multi-cramp?
Yeah. So these are the signs and symptoms. The first thing, you'll have localized pain. Basically, the pain is at one spot. Okay. Then you have like a feeling that you feel like your back is going to cramp anytime. Okay, you can't walk straight. So how your walking will be is somewhat like this. You'll be walking, you can't put your back straight and walk. It'll be too painful. You just want to hunch and lower your back and then walk, or like with half squatting position like that. Okay, and then you can't get off your bed. It'll be too difficult. When you sneeze or you cough, you feel pain in the lower back. It'll be very sensitive. Okay, and then when you turn in bed, when you toss and turn in bed, you're going to feel very painful. You can't have much movement. And then when you sit to stand, basically you're sitting down and you're about to stand, you also feel pain in your lower back. All right. And then the last one here, what we also encounter most of the time is when you're driving and you're going on a hump, a bumper, right? So when you go on a hump, you feel it hurts your back. So it'll be that sensitive. So these are the signs and symptoms. If you have encountered any of these kind of symptoms, do consider that you might have a multifidus cramp. All right?
Yep. So for our audience, if you ever suffer or experience, not all, but one of it is sufficient to kill you enough. All right. So if you have experienced one of it, maybe you can comment underneath there, multi-cramp. Okay. This comment will worth 248 and at the end of the presentation after this. Okay. So basically, let me summarize. So that means if someone is having multi-cramp, right? The symptom is very serious, very acute. You are in pain. Cough also pain, sneeze also pain, teeth toss on the bed also pain, right? When your car drive through the bumper also pain, right? Generally, it's everywhere pain lah. Sorry, not everywhere pain. Every movement pain.
Yeah, every movement.
All right.
Very terrible.
Yeah. So this is a multi-cramp. Yes. So our dear audience, if you ever suffer this or experience this kind of severe pain, all right. So do comment multi-cramp, okay, underneath the comment box, okay. So, all right. So after this, okay. So just now, Simran, you mentioned there are two types, right? Two classification today. So what is the symptoms of another classification?
So next one, just now we spoke about multi-cramp. Now we're going to talk about sacrum swelling. So sacrum swelling, the feeling you get is pain at the tailbone area. So you feel like sometimes when you sit, you feel like your tailbone also hurts sometimes. Okay. When you wake up in the morning, you feel pain in your tailbone and your back, at the lower back, close to your buttock region, before your butt crack there. And when you touch that area, the middle of your back, you feel very warm. Okay, or sometimes when you touch it, you feel very tender. Tender means the second you touch, you feel pain. All right, and then you also can't sleep on your back. You cannot sleep facing upwards because it's too hurt, it will hurt your lower back, and you can't sit or stand for too long. It'll be too difficult for you to do it. So if you have any of the symptoms, a combination of even one or two symptoms, so do consider you might have a sacrum swelling going on. All right, and it might cause you a low back pain in future, or if you're already having a low back pain, you also can have a sacrum swelling at the same time.
Okay, so basically, if I summary, so this sacrum swelling, the pain will be at the tailbone, right?
Yes,
And then it will fulfill all the because it's swelling, so it will fulfill all the inflammation symptoms. For example, pain in the morning, a little bit warm, tender when you touch, right? Yeah. Okay. So today, Simran has shared with us, okay, two types of classification of low back pain. One is multi-cramp, which is a lot more severe. All right, and another one we call it sacrum swelling. All right, it's a swelling around the sacrum, like the picture, right?
Yes.
All right. Okay.
So you can like a bump over here.
Yep. All right. So So what is the causes that cause the swelling at the sacrum, Simran?
Well, so this is the muscle that we look into, which is called the erector spinae muscle. Okay. Previously, when you spoke about hunch pain, I also mentioned about this erector spinae muscle.
Yes.
So the
remember that.
ES muscle, ES muscle goes all the way from your hip and goes up all the way to your neck. All right. So this muscle, when it's overworked, okay, it will over because you have an arched back. Okay, when your back is arching too much, this muscle overworks. Okay, when the muscle overwork, what happens is at the butterfly bone I mentioned earlier, the butterfly bone at the bottom, you'll have a lot of tension going on and also a micro wear and tear. Basically, a lot of wear and tear going on that will cause swelling around that area, inflammation around that area. So that's how the sacrum swelling comes about.
Understood. We are very clear. Good. Poor posture cause swelling at the sacrum.
Yes, poor posture.
Right. Okay. Good. So how about TCM, Suki? So what are the symptoms of low back pain from TCM point of view? And other causes right?
The symptoms of the causes of low back pain I'll be briefing shortly. So the back pain, it can be either one side which is unilateral or bilateral both sides. Okay, and it's not just confined to the lower back region. It can be up to the buttock area, the pelvic girdle where the hips are, and also sciatica pain, which actually from the sitting bone, the glutes, up to the hamstring, to the back of your thigh, to your calves, and sometimes they have tingling sensation up to the toes. And of course, we're talking about lower back. Then we also talk about this is like a house of us, right? With 4 pillars. So sometimes the patients with low back pain, they will have some discomfort of pain in the lower abdomen as well, because above the hips or the lower abdomen, where below the rib cage and all these are where the internal organs are, right? And then, okay, when you get a pain here, meaning there may be some stagnations, so causing compressing on your butt, so you have your lower limbs will get some cold, clammy skin sensation, cold extremities. Okay, so with this difficulty, when you're suffering in pain, definitely you can't be moving about. You'll be having this difficulty in movement, which is sluggish in movement and stiffness, like a robot. Okay, and you have this, as I mentioned earlier, pins and needle sensations or numbness that transmitting down the chi and blood is not being fully perforating towards the ends of your toes. And then, of course, when you have this pain, you are unable to move about, difficult to get up from bed and go back to sleep. Also, maybe you are on a Superman position, you can't lie on the back, like just now Simran has mentioned. So you'll be having this sleepless night, painful night, insomnia. You won't be able to sleep well at night, and also in the daytime you wake up very fatigued and lethargic, right?
Okay.
Any more questions? Understand?
No question. How? Yep. Understand.
Yeah.
Okay. So, okay. The next one I'll brief about low back pain in TCM, as I mentioned earlier. So, lower back area here, lumbar region, is the residence of our kidney system. So, with liver and kidney function is the first thing I would like to point out. So why? Because liver actually governs for our tendons and ligaments, otot lah, right? Okay, your joints area and all this. Kidney governs our reproductive organ systems. So it's actually
Yes.
just around our lower abdomen area, isn't it? At the back and all that. So when you have this weakness, definitely you have pain, okay? And then there's a weakness. Then we talk about the excessive factor, which is a wind-cold dampness syndrome. So wind-cold dampness is three different words. Wind means something that is movable. Wind, it moves anywhere. You can't catch wind, isn't it? Wind pathogenic factor is okay. Cold is something that's cold, like when you chills and rigor shiver, your muscles get contracted, isn't it? That's why you feel rasa ketat like that. You feel very pain. Dampness is like longkang, stagnation, stagnation. So it's like this dampness actually will cause this wind and cold pathogenic factor to be contributing to the back pain. Then the next thing you can talk about the contributing causes is chi and blood stagnation. It's like the traffic light. You get clogged up at the area, that's why you have pain. Yeah. Or after, which often faced by these confinement women, after delivery they have lost a lot of chi and blood. Okay, then definitely chi and blood deficiency, or those who have undergone some surgery, abdominal surgery or surgery around this abdomen area, then they have chi and blood deficiency. Yeah, then they have this back pain as well because lack of supporting. As I said, one house, four pillars. My lack of one pillar.
Yep.
Not so strong anymore. So definitely three pillars also go a little bit. Okay.
Yep.
Then the next one will be leading to the weak spleen stomach functions, meaning weak digestive system. Why? Because when a person eats too much of raw food, uncooked food, cold, any food and beverages that are cold in nature, for example, ice beverages, ice creams and all that, that is a very somewhat to Malaysian hot day or sunny day, then we take ice cream, drink cold tea drinks and all that. That actually some to be contributing to the weak stomach functions. That also can cause to the lower back pain, no? All right?
Okay. So maybe allow me to summarize a little bit, Suki. So basically, if there's a low back pain patients, okay, so from TCM point of view, it could be a liver weak liver kidney function, as well as the spleen and stomach function. And then as well as the chi, right, which is because of the blood stagnation or deficiency. Deficiency means that you are losing the blood, isn't it? Stagnation is like blood clot already, right? Yep.
Yeah,
okay. Okay. Now.
For example.
Okay. So audience. Yes. All right. Right. Okay. So audience. So for those who are just newly joined us, okay, today we are having two special invited guests. We have Simran. Okay, we have Simran. She is a physiotherapist, and we have Shuki. She is a physician from TCM. Now, these both two pretty ladies, they are going to share with us low back pain. Okay, a very, very common problem and illness today. All right, because according to study, there are 70% of humans will suffer low back pain, the high prevalence. Okay, and maybe just allow me to add in a little bit. A lot of people always have low back pain, right? And they always thought it's the kidney problems. All right, now just now Shuki was talking about a kidney function. So it's we are talking about a different thing. All right, the kidney location, where is our kidneys are located? Actually, they are around our upper waist, okay, is protected inside our ribs. All right, now what kidney mentioned here is kidney function. All right, kidney function, whereby you can, it's a kidney function, it's not literally or physically the kidney problems. Okay, because I think we are often, right, Simran, patient will ask us, hey, so my low back pain, is it because of my kidney?
Yeah.
So normally, physically, it is not because of your kidney. But kidney function, yes, possible. Because from physician point of view, when your kidney function not functioning well, all right, that's where it can cause low back pain.
True.
All right, Shuki? Okay, all right, next. Okay, so next, our Simran going to share with us, what are the causes of low back pain?
Yes, so there's summarized to 4 things that will cause low back pain. So first thing is baby bump, okay, and then your standing and sitting posture, also the way you carry your baby, and as well weak core muscles. All right. So moving to next. So I'll explain one by one.
Because these 4 problems will lead to arch low back, isn't it, Simran?
Yeah. Will lead to
arch good. Low back. Yep.
Okay. So what happens if you can see this picture here on the right side? You can see this lady, her bump is very small, and by the 38th week, her bump is very big. And if you also notice, her back is also very arched by the end of the 38 week already. So here's one simple example, that the more heavier your baby bump gets, the more your core muscle will stretch and also will cause your back to arch even more. So the main thing here is that even after pregnancy, you will have this posture with you still. So it doesn't go away. Yeah. So you have to do something about it.
Understand.
Yeah. So the next slide of your sitting position, we always thought that, oh, you must sit straight. So sit straight means you must arch your back and sit all the way straight. So that's not right. So sitting straight, if you can see this lady in blue here, she has the correct way of sitting. So the lady in red, if you can notice, her back is very arched, okay? And the lady in blue, her back is very much straight. So this is what we need. We don't need to arch your back so much and put pressure in your lower back when sitting down. Especially when you sit in office for long hours or you sit in meetings for long hours. You don't need to sit all the way up straight. Just relax your lower back. As long as it's straight enough is good. It doesn't have to arch so much.
So maybe I can give one special advice to parents. Okay, parents, if you are parents to your kids, okay, listen here. Now, asking your kids to sit straight is not a proper instruction. Am I right, Simran?
Okay. Yes, that's very true.
Yes, asking your kids to sit straight, boy, sit straight, girl. This is not a very proper instruction to help your kids, okay, to sit properly. Because when you're asking them to sit straight, sit upright, sit straight, all right, you are asking them to push their lower back into more arch, right, Simran? Is that what you mean?
Yeah. Yes, very true.
Okay, got it. All right, got it. Okay, so hope everyone learned something today, very valuable. All right, no longer ask your kids to sit straight. Okay, how about standing?
All right, the next one, standing position. So even when standing, what we do is when we stand all the way, I'll just show you. We tend to arch our back, and this is, oh, I'm standing straight. This is not standing straight. This is pressurizing your lower back. So what is straight standing is when you relax your back, and this is straight. This is nice and straight. This is nice and straight. This one is arching and a lot of pressure. Your butt may look very big. Your bumps may look big, but that's not the idea. Okay? This is standing straight. More relaxed and more easy on your lower back.
Okay. Okay. All right. So that means what? Even when we are seated, when we are standing, do not push our low back to over straighten, or to not to put our low back to over arch. Okay. So got it.
Yep. All right. And then how to carry your baby, in what posture I should carry my baby. I don't know how to carry my child properly. My back will hurt no matter what. So here's the tip for you. No matter however you carry your child, just make sure that you don't arch your back too much. So all you have to do is, you see like this lady when she's holding a child, the picture on the left side, her back is very arched. So her whole body is shifted forward to support the baby. So that's not what you want. You just need to stand up straight, just lean back a bit, relax your lower back and just stand straight and just lift your child. If it's too tiring, then don't leave your child too long lah. Okay? Or you change with your partner, tell your husband or anyone next to you, please carry my child for a while, I'm tired. Simple as that. So don't carry your child too long. If you really cannot carry, don't compromise your posture for it. Okay?
Understood.
Yeah. So if you can see this lady on the left, on the right side, what she's doing is, she is doing something called the pelvic tilting. Basically, she's rolling her bum. Yeah.
Yes.
So if you want to know how
Michael
to
Jackson.
do it, yes, Michael Jackson.
Yes, our Michael Jackson.
Yeah. So what you can do is you go get a wall, stand by it, and just do what this lady is doing. Just basically roll the buttock down. You'll find your back is straight and flat to the wall. So that is a straight back. All right.
Okay.
The idea is just roll your bum down. That's it.
Yep. The idea is to do Michael Jackson as often as you can, because Michael Jackson is one of the exercises that we introduce to everyone. All right, to build your core muscles. Okay, roll your bum. Okay, so if everyone forgot already, or everyone don't know what is Michael Jackson dance about or Michael Jackson exercise, okay, look into our previous life. Okay, look at our previous life. Yep.
All right. So moving next, the weak core muscles. that I mentioned in the beginning of the slide, how weak core muscle can cause a lot of pressure in your lower back and all your muscles to work harder for you. So if you look at this picture, the baby is small, and look at the core muscle is just relaxed. As the baby grow into the third trimester, okay, the last few months of your pregnancy, your core muscle is so stretched and your baby is also growing so big. So here, baby bump grow bigger and your core muscle stretches out. And if you notice here, the main important thing is the spine. In the beginning, the spine is more relaxed. By the end of the trimester, you can see the spine is curving even more. Okay, this picture don't do much justice, but you can notice that the difference in spine now is more curving. So the picture in the bottom also you can see as the baby bump is growing bigger. Okay, the black and white picture, baby bump grow bigger, and you see her spine also arch even more. So this is one thing that will cause the lower back to arch lah, the weak core muscles.
Okay.
As
So
well,
it's a baby spot lah.
Sorry?
It's a baby spot.
Baby spot partially.
Yeah, partially, yes, I agree.
A lot of pressure in the pelvic girdle. If your core muscles are weak, right? If you can see the baby is like more in like a horizontal like position. So if you have your core muscles more worked and more strengthened, the baby is also well supported and will be more vertical in your body instead of jotting out and slanting down this way. So that's the difference.
Okay. Hold on. Okay, so thanks, Simran. And
No
next,
worries.
Suki going to share with us, right? So how TCM going to help us with this low back pain, right?
Okay. Hi. So basically, first we will check. Okay, I'm back. We'll check what is the underlying cause that contributed to this low back pain. Okay, we'll access first. Okay, we'll do some tests, and then first thing, why it is pain there, we will first clear the localized area of stagnation first, to clear why is it clogging up here. Then after that, if let's say there is some wind, cold, or dampness pathogenic factors that leads to the low back pain and causing the imbalance, then we will eliminate the pathogenic factors. Then after that, we will restore the patencies of meridians because there are so vast vasculations of meridians that are actually running vertically along our back. Then that's where we can replenish the qi and blood circulation towards the malnourished area. Because it get stagnated earlier, so we rid off the so-called pathogenic factors, which are our enemies. Then after that, we will restore the qi and blood circulation to that area. That's when your muscles, tendons, and ligaments are getting enough nutrients, nourishments. Then the muscles are relaxed, and that's where you can actually have to restore the internal organs functions properly, so that you won't have like when you have a low back pain, sometimes you can't, when you cough, when you sneeze, whatsoever, you have this easy leaky urine and all that. So that's actually, with all this addressed step by step, it actually helps to strengthen the muscles in general. Okay, this is what we TCM can do, all right?
And okay, thanks, Suki. So next is, I think it's a very disputable topics, right? Is yoga and Pilates safe enough during and after pregnancy? Especially during pregnancy, right?
Yeah. Even go back one slide behind to Suki's slide.
Yeah.
Okay. So you see, no, just the Suki slide. Yeah. Okay. So the Suki slide, the causes of low back pain, the treatment. Yeah. No.
The treatment.
Okay. Here. Stop. Okay. Okay. So this slide, if you see, right, the core muscle, like I mentioned earlier, if it's too weak, okay, you can see the positioning of the baby is very falling forward, and also a lot of pressure in the lower girdle, the pelvic girdle. And when the core muscle is strengthened, the baby is more vertical. So this will lesser pressure on the pelvic girdle for the mummies, and also the lower back. Yeah. So this is one picture, nice one to explain better lah.
I see. Okay.
Okay.
So thanks, Suki, for the photo.
Yeah, thank you.
Yep. Okay, so what is the explanation, Simran, for this question?
Yes, you can do Pilates or yoga, it is safe. But there's some things you have to be mindful about.
Which are?
Yes, avoid arched back poses. So any poses that makes you arch your back, avoid it. Okay. Yes, theory wise, if you go very deeply into yoga theories and all, they do mention that sun salutation is very good for the mothers during yoga and everything. But okay, there are also many people around who don't really qualify the teaching of being a good yoga teacher. So some don't really teach how to control your hip bone properly in these poses. So might as well you just avoid and be safe. Just avoid these poses. Okay, so avoid poses like sun salutation, cobra pose, and butterfly pose in lying. Like these two mummies here who are enjoying the pose. There's actually a lot of pressure in the lower back. So please be careful, mummies. If you have been doing these poses, I think it's time for you to take a break and don't do it anymore first for time being. So what are the poses that I can do in yoga and Pilates, right? So the poses you can do is the next slide. Okay. These are the poses that are mostly recommended, which is like baby pose, the butterfly pose, and also the Shavasana pose. Basically, Shavasana pose is a very relaxing pose in yoga. So baby pose, you can see this mummy that she's doing. Her lower back is all straightened and there's no arching, no pressure on lower back. The pressure in the lower back is released. So this pose is very comforting pose to be in. Okay. And as well for this butterfly pose, so spreading the legs out like this and folding it and stretching out the hips. This is a very nice pose to be in. It will allow your lower back to relax as well. It doesn't cause pressure on the lower back as much. And the Shavasana pose as well. How is it different compared to the beginning butterfly pose in line? Is that this one, the mummy, the back is supported. Okay, so this one will not cause her back to arch in this pose. So as long as you are supported and your legs are also supported, this way you are more relaxed and your back is not under a lot of pressure. So these are the nice poses to be in, the good poses to be in. Right.
Okay, before this for Simran, right? Sorry, I just add in a little bit. Now, for example, for this sun salutation, cobra, right? Now, if you're in the first trimester, okay, whereby your tummy is not seen yet, and second trimester, whereby your tummy is still slightly bigger, yes, you still can do all these poses, but be aware of your arch back. All right, it's not totally prohibited, right? So, but when it comes to the third trimester, whereby your tummy is a bit too big, like the pictures below there, then maybe you have to try to avoid already. Yeah, because what we know is as your baby is growing bigger, you have difficulty to activate your core anymore, right? But when you're doing the first trimester and second trimester, you still can activate your core to maintain the neutral back, right?
Yes.
So in short run, during the yoga or either Pilates or yoga courses or any gym as well, right? We try to avoid arch back poses, okay? Or we try to make sure that our low back in a neutral back pose, all right? So therefore we still can do, but it's just to make sure that our low back is in the neutral, okay? But just that the baby when it's too big, so we have to avoid when the baby is too big, all right? So I just summarize what you were saying. Okay.
Yeah. Thank you.
So, All right. So next is the treatments. Okay. What are the treatments that physio and TCM can recommend today? Right. A simple home remedy. So I think we start with Suki first, Ken.
Yes. Yes. Please.
Okay.
Yep.
Okay. So low back pain in pregnancy. Not just talking about pregnancy. Even if you are not a man, normal with a beer belly tummy, okay, a big tummy, or you have a weight gain over the months, over the years, that actually contributing the same similar principle where you have an increased weight, then actually you are suppressing on the lower back as well. So how TCM can help with low back pain? Okay, first of all, we can do acupuncture, on which we use the baby fine needles, and we have a Chinese herbs also. Okay, and Tuina acupressure, which is also known as a therapeutic massage. We can also do cupping and moxibustion. Moxibustion is a type of mugwort where we have to warm the area that is consists of cold and dampness. So we actually try to warm it. Similar principle to your warm pad. Okay, so if low back pain in pregnancy, although it is very common, but if it's left untreated, prolonged low back pain in general will actually persist even after childbirth, which turns into a chronic low back pain. So early assessment and treatment can actually help to restore and ensure a pleasant pregnancy experience. You don't want to be pain throughout the whole 9 months, right? And also ensure you a favorable prognosis, correct? So by doing acupuncture, and also you can take some Chinese herb, not just for to relieve the pain, or sometimes actually help you to focus off being in pain and instead enjoy the last few months of pregnancy while gathering your strength for the childbirth. Okay?
Yeah, so actually you're right, Shuki. A lot of pregnant ladies, especially after the baby comes out, their back pain may reduce. But does it that means that their back pain has recovered? So actually it's not really, right? Okay, the back pain, like what Simran says, the arch of the low back is still there. So therefore, you still need TCM as well as physio, right, to fix it. It's just that this round, the baby has comes up, the burden that created the arch has removed, right? But the problem still a little bit there. Okay, correct, yeah? Okay, so yep, Suki, yours?
Okay, so the next, what are we going to talk about is the meridians, right? Correct?
Yes.
Yes, the meridians. So basically, what are the meridians that run through our lower back, our back now, okay? The first meridian that we're going to touch on is the dark blue color, which is the urinary bladder meridian, which actually comprises of 67 acupoints around this along this meridian. It's like a highway where you have every 67 acupoints in 67 petrol stations. So your car is actually moving on each acupoint. Of course, we don't need to prick on every acupoint. We just select a few acupoints that governs that area of pain and stagnations, and we will put some needling around the lower back regions. And of course, the second meridian that is utmost important is the Tu-mite, is the governor vessels, which run centric along vertically along our spine. Okay, then of course some patients will say, I have low back pain, but of course some glute pain, and the pain transmission goes down not at the back of your thigh or calf, but sideways. It goes sideways, katapi, right? So it's where it touch on the liver meridian and gallbladder meridian. These are the areas that we're going to touch on as well. And of course, from the anterior side of view is our kidney meridian, which runs along our abdominal area, okay, just 0.5 inches apart from your navel belly button. That is where the kidney meridian is. Okay, and of course, stomach and spleen meridian is 2 inches to 4 inches apart away. Like it's all along our abdominal area. So it's like when you eat cold stuff, you also get some cramps here, lower back, your lower abdomen, and sometimes it can correlate to your lower back. So it's a front and back. What does it symbolizes? A house with 4 pillars, right? Correct. Actually, that's why Sima has mentioned very important point. Strong core muscles actually ensure stability to our pelvic framework. Correct.
And also hold the baby in a proper way.
That's right. So okay, shall we move on?
Okay. And now we come to our Simran. So she's going to demo to us, right? 5 simple self-help at home.
Yes.
Simple
so there are
self-help.
some exercises I'll demonstrate, and some you have to pay attention on these slides here. Okay.
So again, if you miss the slides or you can't catch what we're trying to say, right, you can also comment slides at the bottom. Comment slides at the bottom, right? We can send you our slides today, all right, so that you can keep it as a reference. Yes. Okay. Now, sorry, Simran, your turn.
No problem. Okay, so the 5 things we're going to talk about: knee to chest stretchings, baby pose stretch, the pelvic tilt exercise, quad stretching. Quad stretching basically is your thigh stretching, and then lunges stretch. So this is the 5 things you're going to look into. So the next slide.
Knee to chest.
Okay. Yes, knee to chest. All you have to do, just lie on your back, hug your knees, and relax your arm. And you just hug your knees all together and just relax. So this one, what you will do is, you can see this lady's back is all flat and straight on the mat. This is what we want. We want your back to just straighten for a while, reduce all the pressure from the lower back in this pose. So this one, any man, lady, child, adult, anyone can do this stretch. It's very helpful when you have any pressure in the lower back. You have low back pain, this is a good position to be in. The second pose will be the baby pose. So why I call it baby pose? Because you are in this pose for 9 months
Like
in your
a
mommy's
baby.
stomach. Yes, as a baby. So when you're out, you come back in this pose is very comforting. So all you have to do is you have to sit on your heels, flatten your heels, okay? And you sit on it, bend your body all down forward, the forehead touching the floor, relax your arm, and you can see her back is all round and nice. So this one, what it'll do is it'll open up all your lower back and it will reduce the pressure as well. It will stretch all the muscles. Okay?
Yes.
And
So,
the third one is this pelvic tilting exercise. So
Michael
lie
Jackson
on the
again.
mat. Yes, Michael Jackson, but this is in line. Just now we
Yes,
saw the
Michael Jackson and lying.
Yes, this Michael Jackson is improved movement. So you do in line, you lie down, bend your knees. Okay, all you have to do is lift your buttock up. This is what the lady is doing. She's just lifting her buttock. Your back is on the mat, is still on the mat. Don't lift the whole back up, okay? Only the buttock up and down, up and down. Okay. So if you are in your trimester also, you can do this exercise, but only do a very few repetitions. Maybe like 5 times you can do, but do an alternate days. Don't do it very frequently. Okay. So this will reduce, avoid a lot of pressure in your core, in your core muscle. Right.
So basically, the first two exercises is meant to stretch the spine, isn't it?
Yes,
Stretch the sacrum swell, to stretch the multifidus muscles, right? And then the pelvic tilt or the Michael Jackson's in lying down is meant to strengthen your core and your glutes, right?
Yes, it'll be core. Yep. So the
correct, good.
Yeah, the stretchings you can do for 10 seconds. You hold for hold for 10 seconds and you do you 5 times. Okay, the stretchings. So this one will be really helpful. So the instruction is up here. If you ever want to view the slide again, the instruction is here and all you can do the exercise is here as well. It's easy for you to view it.
Okay. And for those exercises, I can do it on the bed, isn't it? The moment I wake up, I can start to do the exercise on the bed, right?
Yes,
Bring the knees to the chair.
On the bed
of
also
course, but we make sure that the bed is not very soft at night.
Yeah, very soft, then no fun. You won't feel anything.
No fun. And you may also get more pain.
Yep.
Okay, so we have three exercises here. Now, how about another 2? Oh, sorry. So there's a little message there. Do 5 reps alternate day. Yep. Okay. So, but if during the first trimester, second trimester, I still can do it more, right? For the pelvic tilt. Michael Jackson.
You can do more. Only during the trimester, you have to be careful and do lesser.
Okay, got it. And quad stretch.
Yes, quadricep stretch. Very famous, but very commonly done wrong.
Wrongly.
So what is it?
Yes.
Yes. So whenever you do this quadricep stretch, what we do is we arch our back every time without knowing. Okay. So what you have, and when you arch your back, you can feel, wow, I can pull my leg all the way to the back. I'm so flexible. This stretching is not good enough for me. That is wrong. Okay. First thing, please make sure you straighten your back. Roll the bumps down again, the same thing. Roll the bumps down, and then you pull the leg back. You'll notice you won't be able to pull so much. Okay, so that is the right way of doing. Remember, roll the bumps down, and then you pull your leg back. So this stretching as well, do 10 seconds. You hold for 10 seconds and do 5 times. You can do more as well, no problem. For pregnant mommies, please make sure you are well stabilized. Okay, don't
fall.
Don't do on your own and stand like that. Okay. And the last one, we're going to talk about the lunges stretch. Okay. So what you can do is go on the proposal, the way you propose, your husband proposed you. So go in that way, kneel down. Okay. But you have to move forward from your back leg. Okay. And then you have to stretch. You'll feel stretching on the leg that is at the back. So basically in this picture, you can see her right leg will feel the stretch. Okay. So you can do this position again for 10 seconds and hold for 10 seconds and then you do for 5 times. Or you can do more as well, no problem.
Okay. So summary, basically these 2 are stretching the front muscles, right?
The front
muscles. The front muscles. But at the same time, when you try to stretch them, be aware of your overarched low back, correct?
Yes. In this lunge stretches as well, remember to roll the bumps down and control it.
Understood. All right. So the most important is still take care of your low back while you're doing the stretching.
Yes.
Yeah, don't overarch it.
Yep.
Right. Okay, good. All right. Next. Okay, do you have any other suggestion to relieve the low back? Or I think this is from Suki.
Yes, okay, come back to me
Yeah, thank
again.
you. Mm,
So these are the simple suggestions for low back pain relief lah. Okay, so try to
mm,
refrain from heavy lifting lah, meaning you really have pain, try not to carry heavy lifting like a muscle mania lah. Okay, so
mm,
also we have a correct posture and sleeping position. When you lift object, try to go near to the object and try and lower down the center of gravity, not to stick out your buttock lah. I mean, your buttock may look sexy, but leave it to your loved ones. It's okay, but you don't have to stick out your buttock, okay? And then
mm,
bend down to carry straight. Bend down straight to carry your object. Carry the object near to yourself. Okay, that's the correct way of lifting as is shown on the picture. The correct way
mm.
is like the lady. The wrong L shape that sticking the buttock out. That is
Bending
a
forward one.
wrong posture. Okay, correct. It's
Mm,
incorrect. So the second thing is a correct posture of and sleeping position. Okay, sleeping position, like the
mm,
posture has been briefed way too much by Simran just now in earlier slides. And sleeping position here, I'm talking about, okay, when you sleep sideways, put a pillow or cushions in between your knees, okay, gap in between your
mm,
thighs, okay.
mm,
When you are lying down supine, like facing the ceiling, you can put
mm,
a cushion pillow behind your knees, around the
mm,
behind your knees to actually
mm,
support the cushions around the curvature of your back, okay. And of
mm,
course, the third picture is showing now. It's a very conventional symptoms. Because when you are in front of a computer desk, you're doing your job, you're typing and do whatsoever work, then it's a sedentary lifestyle. It's a habit that we hunch our back. It's like a turtle, wu guai, kura kura.
mm,
And it's like the back also is like outer curvature. Supposedly our neck and our lower back is having the same inner C curvature, isn't it? This is like totally out of it, isn't it? It's totally
mm.
bending the other way around, opposite.
Yep.
So that's actually giving a lot of strain on the lower back and actually very bad for our posture. So over the time you will see yourself like a ninja turtle lah,
Total.
okay.
Yes. Agree.
Okay.
I mean, this is to go back to Simran's previous life, right? Hunchback. Yes. Maybe can I just add a little bit? Now, for the one lying down facing ceiling, right? Like what Shuki advises now. Now, it is advisable to put the pillows underneath your knees if you are having some acute back pain and you are not able to fall into sleep, right? Yeah. So, but I mean, in long run, we still discourage putting pillows underneath the knees because you will try to shorten the muscles that Simran was trying to stretch just now. But in short run, but in short term, whereby, okay, for example, Simran accidentally touched wood today, she sprained her ankle, she sprained her low back, and she couldn't lie down flat to sleep. So best way for her to get her to sleep tonight is put the pillows underneath the knees so that her back can be supported by the bed first. Correct, Suki?
Okay.
Yeah.
Yeah, that's right. That's right.
Okay. Yep.
Otherwise,
All right.
okay.
So that's the small tips from the TCM from Shuki. Now, any other tips?
Yes,
Any
of
other
course.
tips?
When you're in
Yes.
pain, try not to worry so much about it. Try not to say kanchiong say anjong
Mm, mm, mm.
Okay,
Ah,
stay active and positive. Move about. Don't always prolonged bed rest is not the solution. Okay, so if you stay
yes.
active, positive, because your muscles are elastic it can stretch and relax, coil and recoil. So stay active and be positive about it to um, address your problem and your issue. And of course, rest well, eat well, sleep well. Okay, and then try to take a warm and thoroughly cooked food, nutritious food and beverages. Okay,
Yep.
and then the next one is okay. The next slide, please. Okay.
Yes.
Is the food and beverage to be avoided during the back pain. So the food and beverages to be avoided during the back pain is a very simple keywords. Ice lemon tea. Remember ice lemon tea. Why ice? Ice means something that
No
is
cold.
cold in nature. Icy cold. Ice batu lah. Icy cold beverages, raw uncooked food like sashimi, salads, and all this uncooked food. Okay, ice lemon tea. So lemons, what does it symbolize?
Sour.
Lemon means something that's sour in taste. So
Laksa.
any asam laksa, tom yum, all these things For example, sour food actually are associated with liver and gallbladder meridians, because in TCM theory, it's actually governing the health of our tendons and ligaments. So too much sour food actually will cause injury or pain or cramping of our sinews, joints, and all that. So you feel a little bit more pain when you took too much sour food. Because when you taste sour, what is your facial expression? Right? Correct?
Yeah.
So try to avoid
Yes.
food and beverage that sour in taste. And sour, for example, just now Aben mentioned asam laksa tom yum gravy that contain asam, jawa, gulai with asam boy and all that all these things and tea, all sorts of tea try to avoid black tea, red tea, green tea, Chinese tea. But you have
Okay, all
all these
sorts of
muscle
tea.
pains.
I love
Milk
Chinese
tea?
tea too.
Milk
I
tea?
love Chinese tea.
And you can
Gone.
see a lot of complaints from elderly, especially 60s, 70s elderly. They'll come to you, kaki lembut, like jelly like that, because they drink a lot of tea. They thought tea can actually cleanse oil, detox, but in the long run, actually, it gives you pain. When you have pain, try to avoid tea. That's a
Okay.
piece of
Okay.
advice
All
from
right.
our side.
So
Okay.
iced lemon tea is the tips lah. Iced lemon
Yeah,
tea.
70 tricky. Okay.
Yep. Okay.
Okay, and the last
Yeah.
point, okay, is a lumbar point region. This acupoint actually located on the external meridian. It's not on the commonly seen 12 meridians or 14 or the 8 collaterals. This one is located on our hand. I show you this on my hand. This is my hand, and this is 1, 2, 3, 4, 5. You saw these 5 metacarpal bones, right? So on the second and third finger, in the center, you draw the line down to the base of the metacarpal bone, and the fourth and the fifth bone, you draw down. Okay, so they are here. 2 points. Can you get me? Yeah? These 2 points?
Yes.
Yeah, when
Yes.
you press with the tip of your finger, not necessarily your thumb, but when you press gently, vertically, okay, to this acupoint, you can press for about 5 seconds. 1, 2, 3, 4, 5, and then you relax for 2 seconds. Then you repeat again 5 seconds. You do so 5 seconds, relax for 2 seconds. Do such repetitions for 10 times. So at the same time, when you're pressing these 2 points, you can sway your waist, meaning I have to stand up. Sorry. So you just press on these 2 points and you sway your waist a little bit within an acceptable range. Don't try to go goyang, big round on it. You're not doing any tango here, okay? All right.
Okay.
Okay, so these are the tips, but this is like when you want to address it, your simple home remedy, acute attack of your lumbar pain. These are the pain points that you can press on. Okay?
Okay. And surprisingly,
Correct.
I'm feeling a little bit sourish here.
Sourish and
Sorry,
sweet.
Simran?
Correct.
Yeah, I'm feeling a bit sweet here. It's like between the second and third, fourth and fifth, right?
That's
correct.
right.
Between the second and fourth and
Leave out
fifth.
the middle finger.
Yep.
I feel
Yep.
small here.
Small.
Oh, I feel about 2 points are a bit sourish.
Yeah, so meaning you memang
Yes.
ada lower back issue kot.
Oh yeah, I do have. Okay, Tricky, there is a question thrown to you. Okay, how about fruit tea? Is fruit tea also considered as a tea? Fruit tea.
Fruit tea. What sort of fruit may I know? Okay.
Oh, so you look into the fruit lah. What kind of fruit lah?
Every fruit has different nature lah. For example,
So if the
dragon
fruit with
is
sourish, mango.
Mango.
So it's still back to
mango,
the fruit.
Yeah, still have to go back to the nature of the fruits lah. But if you're talking about flower tea like rose tea and all these are okay for distress and to curb anxiety. Those teas are okay lah. But I'm talking about leafy tea that leaf LEA leafy tips. Leafy
Okay.
teas.
Okay. So I think. All right. So last, just a simple one. Okay. This is what Simran has presented today, right? If you have a sharp pain, localized pain, cramp feeling, can't stand straight, can't walk straight, can I get up from the bed? All those symptoms, right? Call us, okay, for treatment. Okay, early treatment is always more important. Okay, because you treat it faster, you recover faster. Yes, because body compensates to pain. When it compensates, you are inviting more troubles. All right. So yep, and today we're going to introduce to everyone. This is our new a combination where east meet the west, where east meets the west. Okay, so Imura Medicare Center is a combination of one TCM and BENPHYSIO, and it's located in Bangsa Village 2. Okay, so today our free gift, we will have one free gift, right? And this is sponsored by Imura Medicare Center. This free gift is worth about 248 ringgit, right? A session of 90 minutes. Correct, right? So I need to invite our both dear speakers. So what is your questions for today? Okay, so guess for those who want to win this lucky draw, right? So you need to tag 3 friends and answer 2 questions. Okay, tag 3 friends and answer 2 questions correctly. Both 2 questions correctly. Okay, Simran, question number 1.
Yes. Okay, so just now, what are the classifications of low back pain? There's 2 things I mentioned about just now that is the diagnosis basically of what is causing low back pain. There's 2 things, the classification. So what are those?
Yes. So question number 1 from Simran from Physio. What is the classification of low back pain, which is start with multi and something swelling? Right. Okay, how about Shuki? Your second question?
Okay. So
second question from your side.
what are the F and B to be avoided? What are the keywords, food and beverages to be avoided when you have pain, back pain especially?
Okay.
Typically?
So today we have 2 questions from our dearest speakers. Okay. So question number 1, what are the classification for low back pain? Okay. So in physio, how we classify low back pain in 2, and what is the keywords? Okay. What can I say? What are the keywords in food and beverages? All right. Whereby you have to avoid if you are suffering low back pain. All right. So for our audience, we have 1 minute from now. Okay, we have 1 minute from now. Tag 3 friends and answer both questions correctly. Answer both questions correctly. And Suki, I think just now go back to just now the question, right? So she was asking passion fruit tea, something like that.
Passion fruit tea.
So I guess passion fruit it falls under the iced lemon tea category, right?
Yes.
Yeah, the tea may be a good one because the tea is a fruit juice, right?
Yes, it's good. It's good for digestion.
Because of the passion fruit. But because of the passion fruit, maybe.
Yeah, when you have back pain, try to avoid. And maybe you can try other tea, lavender tea, rose tea,
dragon fruit tea.
Dragon fruit. No, there's no such thing as dragon fruit tea.
I don't know. I don't know. Okay, so we are waiting for everyone's answer. We have 5 more seconds to go. So our lucky winner will entitle a free sessions of 90 minutes in Imura Bangsa Village 2. Okay. So again, we urge if you are having back pain, low back pain, or if you have friends who are having low back pain, you can tag them as well. All right. So and okay, that's all. So today thanks for Shuki, physician from our TCM, and thanks for Simran. Okay, thank you for the lovely sharing. All right, thank you for the lovely sharing. Yes,
thank you.
I think both of you has made it very simple. Yeah, both of you has made it very simple and yet very fruitful. All right, very fruitful.
Yep.
Okay.
Thank you.
So for next week, next Saturday, okay, we will have a last topic of women's health. We are talking about weight management. Okay, we will be talking about weight management, how to manage your weight postnatal, especially. All right, so stay tuned next Saturday, 4 o'clock, same time. All right, so we're going to leave here. Yes, and goodbye.
Okay, bye.
Thank you.
Thank you.
Bye-bye.
Bye.
Thanks. Bye.